Hi, I'm Dr. Bishop from Animal Healthcare in Naperville, and today we're going to be talking about dog allergies. And my assistant Judy is going to be asking me some questions, which I'll answer to the best of my ability.
All right. So, how common are dog allergies, Dr. Bishop?
Well, actually, dog allergies are so common that it's one of the primary reasons why pets come into us, dogs come into us for care. They may present with all sorts of different symptoms, but they're extremely common.
Okay. And then, what are some common dog allergies?
Well, there's environmental allergens like flea allergies, there's pollen allergies, there's house dust mite allergies. Some dogs are actually allergic to their owners. Food allergies are another big issue, but there's lots and lots of different allergens that are out there. And sometimes, just like with people, if the mold count is low enough and the pollen count is high, the person may be just fine, but when both the mold and pollen count are high, then there's a problem. So the dog may have many allergies, but if multiple allergens are not triggered at once, we may not see any clinical signs at all. So.
Okay. And then, how do allergies impact the health and well-being of my dog?
Well, I guess anybody in the group that's watching this video that has had allergies knows just how much they drain the individual of energy and how much they really create a very, very, very poor quality of life. So when your dog's itching and scratching and extremely uncomfortable and has developed a hot spot, or they're chewing at themselves, they're very, very much impacted by the allergens. And the owners sometimes will talk about the lethargy that's associated with that.
Okay. And then, what are some signs and symptoms of allergies in dogs?
Well, I have a pretty robust list here, and I'll start just more from memory. Recurrent ear infections are a common sign of allergies. Frequent bowel movements actually seem to be associated with food allergies. Itching and scratching and chewing are all signs of allergies. Sometimes we'll see diarrhea. Much less so we'll see hives. Usually see hives associated with insect bites and allergic reactions to vaccines and things like that, not so much as the mainstream. Reddened and inflamed skin. Recurrent skin infections many times have underlying allergies, as do recurrent ear infections many times have underlying allergies. Swelling of the face and lips, again, more of an acute type allergy reaction. Vomiting can also be an allergy to food and things like that. If you're around your dog and the dog smells abnormal, sometimes that's due to infection, sometimes it's due to the excess oils that are just secreted from the very irritated skin that become rancid and smell a lot. So the smell of the dog can be an issue. We have some dogs that come in that actually look like raccoons. They have areas around the eyes where the hair has almost like fallen out, and they're swelling around the eyes. So, I've termed it raccoon eyes sometimes. Sensitive skin, sensitive to touch. Eyes can sometimes be very runny too with allergies. Now there are those dogs, like the poodles, that always tear out of the face because of the anatomically small tear drainage ducts. But these are dogs that basically never have eye discharges and suddenly develop them, and it's associated with the allergies. So.
Okay. And then, can I diagnose my dog's allergies at home?
Well, you can get an idea that you probably have allergies. We have a hard time here sometimes pinpointing exactly what it is that the dog is allergic to. And in more recent times, we have drug modalities and injectable, what we call biologicals, that we use that don't necessarily require a pinpoint therapy. Like if you take an antihistamine tablet, you don't necessarily know what you're allergic to, but you take the antihistamine and it blocks the histamine and helps you. So, but as far as figuring out what they are, that can sometimes be a bit of a challenge. Can require a food elimination diet. Is the only way we figure out what the dog's allergic to food-wise. And as far as actual allergens, there are blood tests saliva tests, and also the most common one is injection of the skin with allergens that are made up specially for that purpose. So.
Okay. And then how will the veterinarian diagnose allergies in my dog?
Well, sometimes well, most of the time we won't diagnose them specifically. We will say that the dog has allergies, but we won't diagnose the specific allergy. And a lot of times we're using drugs like Apoquel, which is an oral medication. There's also a biological called Cytopoint. Other times, some people will use antihistamines. There are veterinarians out there and lecturers out there that say antihistamines don't work. I would tend to beg to differ. I think they do help to some degree. They're not as effective as some of the newer drugs and compounds that we have, though.
Okay. And then how are dog allergies treated using anti-inflammatory therapy?
Well, actually, the use of anti-inflammatory therapy, I would assume you're talking about steroids and that sort of thing. I think steroid usage is really become a much less common thing. Back many decades ago when I got into practice, the dog would come in for an allergy shot, and it was a long-acting steroid, which can have some pretty profound physiological effects on the dog, causing excessive urination and suppression of the adrenal and suppression of the overall immune system. Today, we're using drugs that act by blocking other steps in the process. And I'm thinking in terms of Apoquel and Cytopoint. There are also drugs like Atopica, which is a cyclosporin that's used also to block and handle allergies.
Okay. And then how is shampoo therapy used for dog allergies?
Well, the shampoo will remove allergens if there's an allergy that has weakened the skin and helped to invite an infection of the skin, much like the person that has asthma, maybe at the hospital with a pneumonia a lot of times after they've had an asthma attack or their asthma has been going badly because the asthma weakens the lungs, and then we end up with a lung infection or pneumonia. So the allergies of the skin can actually weaken the skin. So the shampoos have antibacterials in them. A lot of times they'll have things in them that'll soothe the skin. So they remove the allergens, reduce bacteria, they'll reduce fungal components that also cause a lot of itch, and just overall rehydrate the skin and make it feel much better. We're moving into the time of the year right now, and the indoor relative humidity, especially here in the northern Illinois areas, it becomes very, very low, and our skin becomes dry and itchy, and just rehydrating it can be very soothing. So the bathing is extremely valuable. Another very interesting point, the really super resistant infections that we don't have antibiotic therapy for, we're finding that the veterinary dermatologists are using shampoos and other things in shampoos, sometimes even using bleach to reduce the surface bacteria and treat the infections. So shampoo therapy and topical therapy is definitely extremely valuable. In the big scheme of things, we as veterinarians are kind of under the watchful eye of the FDA. They don't like us using a lot of antibiotics. So if we can resort to and actually use shampoo therapy and not oral antibiotic therapy, which could put some more resistant strains of bacteria out in our environment, they actually like it much better. So.
Okay. And then last question, what is hyposensitization or desensitization therapy for dog allergies?
Okay, so desensitization is actually a process by which we expose the patient either by injection, or there's sublingual therapies under the tongue therapies, to small amounts of the things that they're allergic to. And what happens is the body creates things inside of it that counteract the reactive agents that trigger the allergy. So we give small injections and increasingly larger injections to gain some tolerance on the part of the patient and actually kind of build an immunity against the thing that we're allergic to. So if you're allergic to cats and your dog, you would give cat allergen by injection or sublingually, or house dust mites is another big one. If you've got a house dust mites allergy, you would basically then inject small amounts of that, ever increasingly larger amounts, and build a tolerance in the body. So you build an immunity, much like we would do with a vaccination for COVID or rabies or anything else. We build an immunity against those things.
Okay. And then if I have more questions regarding allergies in my dog?
Well, I mean, if you have more allergies, any more questions about allergies, feel free to give me a call here at Animal Healthcare. Our number is 630-305-7200. Our website is vetnaperville.com, and thank you very much.